Welcome back to Spotlight. I'm Edgewenka. I'm here with Dr. Sandra Delon. I think I got that right. Yeah. She's, of course, the Director of Chronic Disease Prevention at Alberta Health Services in Canada. And I've been also joined by Miss Ivy George from the Ministry of Health and Social Development. She is the Health Promotion Coordinator. Yes?
Yes.
Welcome to Spotlight.
Thank you.
Well, you're no stranger.
Thank you.
Thank
you.
Welcome,
Pleasure to be here.
Dr. Delon.
Yeah.
So it's real good to have you. First, let me talk to you, Ivy.
Yes.
Of course, I know that you are coordinating the national strategy for the prevention and the control of non-communicable chronic diseases. And this is a part, Dr. Delon is here as a part of your strategy. Talk to us a little bit about that.
Yes. As you're aware, Mr. Smith, for the last year, we have been implementing of the prevention component of our 10-year strategy. Now, the 10-year prevention strategy deal with prevention, and we are looking at things that the social determinants of health that happen outside of the Ministry of Health. So we are working with labor, we want to, education, we are working with healthy spaces and places, and we are working with schools. But there are also some people who have already gotten the disease or who have risk factors. And we want also to prevent them from not falling into the other stage. So we also need to strengthen what the health component as well of the program. So Dr. Dillon is here this week to do an assessment, and she will be helping us to develop a strategy, a complementary strategy to the prevention one that will deal with helping us to offer better quality of care for a person with NCDs, and also to that we really want to, even though you have the disease, we still want to offer you the best quality of life that we can. And we can do that even though you're already sick.
And we're trying to keep people, for example, off of dialysis, even though they might have challenge diabetes or
so we
other
want
heart
to try
conditions.
to keep you as long as possible from not falling into a complication. And if you have a risk factor like high cholesterol, obesity, we are trying to keep you from going down to the next step, which would be maybe ending up with a stroke or diabetes or heart failure.
Okay. Now, Dr. Delon, this is your field. You're the Director of Chronic Disease Prevention in Alberta Health Services. What are you planning to offer us? Along with the assessment, what can we expect as a deliverable from you?
Well, what I want to do is share some of the experiences that we had in Calgary when we started changing the system to better manage chronic diseases. We started doing this in 2002, and over the years we've learned a lot about how to do it, and it's an enormously difficult thing to try to change the system, because our health system is designed to manage acute illnesses. And it's not designed at all to manage chronic diseases. So we really have to change all aspects of the health system if we're going to make a difference. And we have to make a difference because over half the population has a chronic disease, and it's costing pretty much worldwide 2/3 of the healthcare budget is being spent on chronic disease.
So you have a similar statistic in
Very
Canada?
similar. It's similar pretty much all around the world. And the other statistic, which is frightening, is that only about 50% of chronic diseases are managed well.
So we don't get the proper care once we have developed these diseases.
Yes, but we can change, but it takes a whole system approach with all the different players involved in healthcare working together to make the system change.
So what kind of treatments that we need to be doing, what level of treatments need to be on that is not on right now?
Well, one thing is that the patients need to be much better informed about their condition. So educating patients about their diseases is critical, because they need to be vigilant for the signs and symptoms to watch for, so that they can quickly get into the doctor's office or see the nurse before they start to deteriorate. So that's one of the main things that we need to do.
We have not been taking enough responsibility for our own health.
And we haven't known what to do. So not only we haven't taken responsibility because we haven't known what to do.
So education is a major component.
Education is very important, and teaching people how to manage their own condition, because we manage them. We only spend about 1% of our time, at the most, in the doctor's office. So we are managing. We want to teach patients to manage well. Otherwise they're not going to be able to monitor their signs and symptoms.
So if we have diabetes, for example, we know that to take our medications on a regular intervals.
Exactly.
What kind of exercises we need to do, what kind of foods we need to,
That's right.
to eat and not eat.
Yes.
And that's the type of information that we need in order to manage the conditions that we may have.
Exactly. And with a chronic condition, whether it's diabetes or hypertension or asthma, we have them, when you have them for decades, for life. And they wax and they wane, so they go up and down. And a lot of different providers are needed to help the patient manage their condition. So sometimes they'll need help from the nutritionist. Sometimes they'll need to talk to the pharmacist about their medication. So it doesn't remain the same.
So one aspect of your work is to help us to bring that management and to raise the level of care.
Yes. Yes.
Okay. Now, prevention is worth, ounce of prevention is worth a pound of cure.
That's right.
As all the old time people used to say.
Exactly.
Right, in every part of the world.
Absolutely.
It's interesting, right?
Yes.
How are we going to get to the prevention stage given the nature of the cause of the disease?
Well, this is where the strategy that Ivy started to develop with health promotion has to work hand in glove with the chronic disease management strategy. So the suggestions that I'm going to make and the literature and evidence that I'll be reporting on is for people who've got the condition, but we also need to work on those who haven't got the condition so they stay well and healthy. The two things have to go together.
What have you been doing in Canada towards the prevention end?
Interesting, we're just starting to work on that. We took the opposite approach to what Ivy took here in BVI. We started on disease management first, and now my role is working on primary prevention. Whereas Ivy took a different approach, working on primary prevention first and then disease management. So what we're doing in primary prevention is we're looking at the key 5 risk factors, which are smoking, nutrition, alcohol, physical activity, and stress. And we're doing it across the sector, so we're working across the age groups, and we're also working in different sectors like the community and in workplaces.
Okay, so you're looking to change lifestyles.
Exactly, yeah.
Now, you and I both know that it's virtually impossible to change lifestyles. How are we going to get these lifestyles
It's
changed?
very difficult. And I think that's a very good point, because it's not just us changing. We also need to have a supportive environment to help us change. So one of the things we're doing is we're looking at the built environment to see if when we tell people to go out and exercise, that they actually have a safe area to do this, with a pavement and a nice area to walk, where they feel comfortable and can go and do it. And when we tell people you have to eat better, we have to make sure that healthy food is accessible and it's not overly expensive. So that's making sure that we have a supportive environment, so it's not just about what you do.
Who are the partners we're looking at in the prevention strategy in the community?
I'm going to pass that to Ivy, because that's your area. Yes.
Well, I understand it's Ivy's area, but in a general sense.
Oh, in a general sense. Oh,
yeah.
it covers many sectors. For example, transportation, and when we're looking at the built environment, education, when we're dealing with schools, organizations for workplaces, we need to work with them. I would say they're the major ones that I can think offhand, but it's almost more difficult to do primary prevention because there are so many diverse stakeholders involved. It's actually easier to do management because you're working within the health sector.
Have you been developing legislation to maybe coerce, let me use that word,
Yes.
to coerce the stakeholders and the partners into
You do.
making a contribution or participating
That's
in
right.
the prevention?
There's totally a place for policy. And we certainly have noticed differences when we raise taxes for cigarette consumption. And so we know that's important. Bike helmets to prevent injuries is another key. And all those sorts of things need to be legislated.
Okay. Now, Ivy, your strategy has been, it has started for what, like a few months now?
No, we are into 1 year. We have already been implementing for 1 year, and we have been able to establish partnership with the Ministry of Health, the Ministry of Education and Culture, and we are now also embarking on doing the same thing with Labour, We are working with town and country planning, and they are dealing with our spaces and healthy spaces and places. And so we are also working with the health services, because as you're aware, the health services are done by the board and they're not really under the ministry per se. So they're also one of our partners. So we are trying to strengthen those areas. And in the Ministry of Health, as you're one of our participants in the social marketing. So we are trying to also strengthen the capacity of the Ministry of Health to design programs that will do more than just raise awareness. We are hoping to do behavior change. So those are the 5 areas that we have begun to make some very good inroads. We have a very vibrant interdepartmental committee, but it's chaired by the Honorable Archibald Christian, and I must say that he's doing a very good job, and also the committee members. These committee members, many of them are in charge of subcommittees, and they report back to the committee. We have a action plan for the first 4 years. That's what we are following to be able to make the changes.
Okay, we're going to take a break for a word from our sponsors, and we're going to come back quickly.
Yes.
We've of course fallen under the tyranny of the clock, and we're going to talk a little bit about where the time frame we are expecting to see deliverables, where we're expecting to see change, and what shape that change, what form that change is going to take. Keep it locked right here to Spotlight. We'll be right back after these words from our sponsors.
Spotlight is brought to you by the National Bank of the Virgin Islands, the BVI Tourist Board, and CCT Global Communications.
Yeah, welcome back to Spotlight. I'm having a really great conversation with Dr. DeLon from Canada, from Alberta. She's the director of the chronic disease prevention at Alberta Health Services, along with Miss Ivy George. She's been here with me many times. She is the coordinator for health promotions
and the national focal point for chronic non-communicable diseases.
Thank you, Ivy. I'm claiming all my senior moments. I'm claiming all senior citizen stuff. But thank you for bailing me out there. We'll be having an interesting conversation because, as you know, chronic diseases are killing us, and at the same time, it's killing us. It's costing us millions of dollars. It's really one of those things that we really need to address immediately, if not sooner. What kind of time frame are we looking at to see some results from all of this activity? Because you're doing a lot of activity. Dr. DeLon is here to do some assessment, to help us to improve the management of our chronic diseases, as well as offer us some suggestions and advice on prevention. What kind of time frame are we looking at to see some results?
Well, in the first 4 years, you will just see maybe we'll raise some awareness and make some system change. And I'm really working on the system change and putting the infrastructure in place, because we are really moving towards a major paradigm shift. And so these infrastructures were not there, so it has taken quite a bit of time to put in the structures. But we are moving in the right direction. People are beginning to understand and to catch on. And we are especially hoping to begin to roll out some more of the social marketing things, like around September this year. So, but before we got to that part, there was some major infrastructure thing that we needed to put in place to help people to understand it's collaboration, it's working across the sectors. We all want to be on the same page. We want to make sure that all policies that are being put in place by others are in no way infringing or causing damage to health. And so by having this committee in place, we have begun to really be able to bring the issues to the table and to get a cross-sectional view on the things that are happening. And this has been a major breakthrough. Now we have two other committees. We have a committee at the national level, and we also are trying to put in the infrastructure at the community level. Those have not gone as well as we want to. There need to be some additional work in this particular area, but I spoke with the minister this morning and Mr. Christian, and we have decided that we need to have a meeting very soon so we could discuss the revision of these two areas.
Okay, and of course the community committees are the ones that we really need to put a little more emphasis on, particularly in terms of the education process and the activities that's going to
at
get
the local level, the coordination at the local level. And this is very important because what we have been doing over the years is we have always tried to drive things from the center. And number one, we don't have the manpower. And number two, because we don't involve the community in an active way, there is no sustainability, there's no empowerment, so they're always looking back to government or looking back to professional people. And a lot of what needs to be done in primary prevention, you don't need professional people.
You just need people, the community to accept it, embrace it, and manage it themselves.
Yes.
Yeah. And of course, some of the things that we need is exercise, activity,
yes,
and understanding of nutrition,
gardening, healthy
producing
cooking,
food,
and how, as you're talking about, how to eat and making sure that some of these things are available. One of the things that we had a major problem with was with alcohol. Many people are having 5 drinks in one sitting, and that has been undermining their health. So that is something that we need to address. We also need to address the issue about how people are managing stress. So there are quite a few things, but a lot of these things can be done at the community level by having the community involved. And I can't stress this point enough, that we really, if we're going to see the kind of changes that we want, that we're going to have good community buy-in.
And I think we should take this opportunity to let the community know that let the community know we have a few committees already started, and that they need to join up where they can join, if they're in numbers, or just come to a person, just any so that they can make contact with the committee. Okay, I think we need to encourage them to do that.
The 5 communities that we were piloting, we have 4 of them up and running. That is Virgin Gorda, Easton, Bellevue, Long Trench, and Hope Hill, and the Northwest communities, which encompass King Garden Bay, King Garden Bay, Bruce Bay, etc. And these committees are supposed to be coordinating committee, because there are a lot of stuff happening in communities already, but everyone operating in a silo. So there's no one that is bringing people across and say, look, at the community level, what you want is people working together. You don't want to be duplication, you don't want fragmentation, and if we will all come together, then we will get more synergy. We'll be able to make sure that no one is stepping on each other's toes, we are not overlapping, etc., and that you're not fighting the community to try to say, oh, support my program, you'll be supporting, because what we are looking at is healthy communities. So it's encompassing of everything. So if we are dealing with crime, that will help us, because that will make us not be as stressful as we should be, if you're safer, etc. If we are dealing with climate change, whatever you're dealing with, it can all work together, because we are trying to build healthy communities.
And it makes everything sustainable.
Yes. More sustainable. Yeah.
So, Dr. Lilon, you're going to be with us for what, a week?
A week, yes.
Okay. And at the end of your stay here, just go over briefly what we can expect.
Yes. Well, what I'm doing while I'm here is talking to a number of providers and getting an idea of their perceptions of where we're at with managing chronic disease and where we should be prioritising. So on Friday, before I leave, I'll be presenting a report identifying where the people I've talked to have said the issues are and what we should be focusing on initially to better manage chronic disease.
I want to thank you both for being
Thank you.
My guest
Thank
on
you.
Spotlight certainly is good information, things that we need to know about. Glad to have you. We are expecting that your assessments and your reports are going to enable us to, or empower us and strengthen us to manage the chronic disease situation, and more importantly, to help to prevent it. So it's good to have you. It's good to have you on Spotlight.
Thank you.
Yes.
Thank you.
All the best. Ivy,
Yes.
good to see
Yeah.
you as usual.
Thank you.
Yes.
Yes.
We're going to take a break. When we come back, we are going to be talking about the much talked about addition of 1 year to our school life here in the territory. We're going to clarify that position. We're going to talk about the quality, the improvement of the quality of education in the territory, and how all these things are working together to improve that quality. I'm going to have with me, of course, Ms. Connie George and Acting Principal Jeremy Scatliff. Keep it locked right here. You're going to get an opportunity. We're going to open up the phones. You're going to get an opportunity to call. The program is extended, so we'll be here to at least 10 p.m., perhaps even a little longer. Don't go away. We'll be right back after these words from our sponsors.
Spotlight is brought to you by Tortola Concrete Limited, Clarence Thomas Limited, and H. Lavity Stout Community College.